Good morning, everyone. Thank you for joining us for today's webinar, What is Life After Coronavirus? Understanding Employer Compliance and Safety, presented by Rea Associates, a top 100 regional CPA and business consulting firm with offices across Ohio. My name is Imani Fields, and I will be moderating today's presentation. Before we get started, there are a few housekeeping items to cover. First, if you have any questions during today's presentation, you may enter them into the chat box on your screen. We will try to answer as many questions as we can at the conclusion of today's presentation. However, to be respectful of your time, we know that we will not be able to get to them all. Therefore, following today's presentation, we will review all questions and send out the answers via email as soon as we can. When you receive this email, you'll also receive the recording of today's presentation, as well as a link to participate in a very short evaluation. Please take a few minutes to share your thoughts about the presentation as a whole, the information provided, and our presenter. Your feedback is important to us as we determine the future webinar topics related to the current COVID-19 crisis. Also, if you would like a copy of today's slide, you find that they are available in the handout section of the webinar dashboard on your computer screen. Please note that the resources presented today are for informational purposes only. Rea Associates does not provide legal advice and will not make management decisions for your organization. You are encouraged to consult with legal counsel of your choice prior to implementing any policies or procedures within your organization. Today's webinar will be given by Renee West, Senior Manager and Leader of Rea Associates HR Consulting Practice. With more than 27 years of experience in human resources, Renee specializes in assisting organizations within the manufacturing, nonprofit, contingent staffing, food, and other industries with their HR challenges. She is currently serving on the Ohio Society of Human Resource Management Board of Directors as Central District Director. Today, Renee will hone in on how you can protect your organization, your workforce, and their families during today's COVID-19 crisis. Specifically, she will address the creation of certain HR policies, potential legal liabilities, and the future of HR in your organization. All right, take it away, Renee.
Thank you, Imani, and thank you everyone for attending today's session. We are all experiencing a very challenging time. Our goal for today's webinar is to provide you and your organization with resources. As we know, there will continue to be updates daily as these situations evolve. Please utilize the websites and resources provided in today's webinar. Let's talk a little bit now about what our agenda for today's discussion will contain. We will talk through some CDC facts and state resources, provide information in reference to the Families First Coronavirus Response Act, provide details on some compliance and legal liabilities as it relates to the Family Medical Leave Act, the Americans with Disabilities Act, Department of Labor and Compensation, unemployment compensation, and we'll also talk through some employee discussion guidelines for each of you as you continue discussions with your team. We will also talk through and provide you with some proactive employer approaches as we move forward and continue through the next few weeks and few months, including best practices for your handbooks, how to handle leaves, talk through some remote work policies, and just ensure that you have policies and procedures in place for crisis communication, and also talk through what are best practices for those employees that might have been laid off, so we can help to retain staff as business continues to move forward. I'm sure everyone has seen the graphs that have been put out by the CDC in reference to where we currently stand. Within the state of Ohio, as of yesterday, there were 88 confirmed cases of COVID-19. Our goal is not to go through each of these stats, but share with each of you why we are where we are at this point, and also talk through the importance of sharing this information with our employees and our team in reference to the importance in practicing social distancing and also ensuring that they have resources to know what all these terms mean. This is a lot of information for everyone to take in. So again, what we are doing now, what the state is doing from a level, is to slow the spread and mitigate any continued spread of this virus. Resources for you to talk through with your employees. Please see all of these sites that we've listed here, including the CDC webpage, the White House Task Force, the Ohio channel for Mike DeWine's page, and the World Health Organization. All of these links are credible resources for you and your organization to utilize. As you know, social media, there's a lot of information out there. We want to be sure that what you're sharing with your employees and your team members is accurate information to the best of what we have at this time. For your information, the governor does conduct a daily press conference at 2 p.m. that is accessible by everyone, and this is definitely a resource that we recommend that if you're able to attend, to do so, as it does share a lot of up-to-date statistics and next steps. As you know, he made recommendations yesterday, to close a number of types of businesses, and I'm sure there will be some additional discussion today. So let's look at some resources that we have for employers. Again, as we move through this, there is a lot of information, and all of which it's hard for us to get all this in an hour-long call. But one of the biggest resources for employers is talking through the Shared Work Ohio. And this information is available on Job and Family Services website that we've indicated here on this slide. Please take some time to look at this and look through the specifics, as this is an alternative to layoffs for employers. This allows workers to remain employed and employers to retain staff during times of reduced business activity. There's statistics and data that you need to provide. Employers should provide the Ohio Department of Job and Family Services with a list of participating employees, details on the work schedule, and this also applies to part-time employees as well. Again, a lot of information for us, too much to cover on this slide, but definitely a resource for you to check for some resources for your organization. The next biggest part that we want to talk through is legislation for what is called the Family First Coronavirus Response Act. If you've listened to the news, this actually was approved by the Senate late yesterday and signed and approved by the President last evening. We will be talking through a little further details on what this act and what this means to employers. Keep in mind, this is a very fluid situation. They do not have all the details out yet, but we can share what we know at this point. The Act does provide free coronavirus testing, paid emergency leave, enhanced unemployment insurance, additional funding for nutritional programs, and protections for healthcare workers and employees, and additional federal funds for Medicaid. The biggest part of this act is the paid leave, and that's what we're going to talk a little further about. And again, that is where further details will be forthcoming as we move through today and the next couple days. The pending details at this time for paid sick leave, it basically states, again, this is as of this morning, again, more details coming forward. Employers are to provide 80 hours of paid sick time for those individuals that are mandated under quarantine due to COVID-19, at the onset of symptoms for the virus, caring for a relative that is in quarantine. Also covers child care due to closed school or daycare providers. So if one of your employees needs to remain home to take care of their children. There is also a monetary amount. Again, this is something that will be confirmed as we move forward, but there will be, as it stands right now, capped at $511 a day for workers' own care or $200 a day for care of elders. And this is a temporary act. Tentatively, it is to expire the end of 2020, but again, that can change as well.
Okay, so as we talked about the legislation that was just approved by President Trump, again, we're waiting for further information about when the actual effective date of this will be. This will impact large and small businesses in a number of different ways. Private businesses with more than 500 employees would not be covered under this particular act. Employers with fewer than 50 employees could file for an exemption from providing this paid leave if it would jeopardize the viability of the business. Again, this is a lot of information. It will be further defined as we move forward about how employers can go ahead and request that exemption. So stay tuned for further details on that. So let's talk about how this act ties into current laws in place for the Family Medical Leave Act. As we mentioned earlier, family medical leave is unpaid time for employees to take off of work to care for themselves or an immediate family member that has a serious health condition. FEMLA applies to employers that have 50 or more employees within a 75-mile radius, and it is unpaid time for up to 12 weeks. So if we have an employee that is going to be going off on leave due to the virus, the Family Medical Leave Act will run concurrent with the new legislation as far as time off. So this again will run hand in hand with the legislation that the president has, just signed as of last evening. So further details will be coming forward as to how employers can monitor and apply information and be compliant with family medical leave. So let's also talk about Americans with Disabilities Act. Again, this is HR related, where we have the knowledge and understanding of knowing that if we have employees that might be off due to this virus, it could trigger an event where an employee would be eligible for protected class under Americans with Disabilities Act. Again, this is just something that could come up. We need to be aware of and know that if an employee develops a disability due to the virus or it aggravates a pre-existing disability, they may be entitled to a reasonable accommodation. And again, that's where next steps from an HR professional or a manager of your office would need to have discussions about possible accommodations for working remotely, reducing work schedule, and no travel. Again, this is just a compliance piece that we need to be sure that employers are thinking of as we move forward. Let's talk through unemployment compensation, which is definitely a very big question for a number of employers right now. How do we handle when employees are coming to us with questions, or we know that we need to possibly do a reduction in staffing due to the virus? So again, there are a number of resources, but let's talk through, will a worker qualify for unemployment benefits if the virus causes employers to lay off employees due to loss of production? Yes, they are eligible if they meet the eligibility requirements per the unemployment compensation guidelines. Do workers qualify for unemployment benefits if the virus causes the employer to shut down operations? Again, that answer is yes. Unemployment benefits will be available again for eligible individuals if there's a relation to them being off work due to the virus. It's important to keep in mind that legislation already passed a number of weeks ago where the waiting period for unemployment eligibility has been waived. That is new, and that will be helpful for those employees to be able to request unemployment right away versus having a waiting period. Some other common questions that we have in reference to unemployment compensation is, if an employee receives unemployment benefits, will the employer's employment taxes increase? And this is a very common question. And at this point, for contributing employers, charges during this time frame will be mutualized. And we've referenced on there to follow the Ohio Revised Code, Chapter 4141, that will help with the unemployment compensation. The biggest resource for you as an employer will be to utilize and steer your employees towards the website that we have listed in the handout, that is the Job and Family Services Unemployment Compensation website. This provides details to the employees on the process that they need to go through to apply online for unemployment benefits. There is also the option for employees to call in to do their benefits via the phone. However, the government is recommending that they utilize on-site registration or online registration as much as possible to avoid lengthy holds on calls, etc. The unemployment site will be the resource for any questions that the employer has, any questions that the employee has. We've also put in our slide deck a fact and question resource page with a number of common questions in reference to unemployment that will be helpful for you to share with your employees as well. Please keep in mind with unemployment compensation that the unemployment is not 100% paid of what their normal wages are. There is a scale based on how individuals, how long they've been employed, etc. So again, use this resource as the opportunity. If you have questions, there are phone numbers for individuals that can help navigate or anything, help you with those questions, because your employees are definitely going to have questions as well. And the site's very informative as to what the employee needs to have ready before they get ready to apply for unemployment. For example, have their driver's license or their ID, have all that information ready so they can get through this process as quick as possible. So let's talk about the Department of Labor and Compensation. There are a lot of questions right now on what are our resources as an employer if we have individuals that are not working full work weeks. So let's look at, there are two resources that will be in your handout. One of them is to the Department of Labor webpage that provides specifics and guidelines to keep in mind for individuals that are not working full work weeks. Federal labor law applies to hours actually worked. So employers need to pay employees for the time that they have worked if they're on an hourly basis. Exempt and salaried employees must receive their full salary in any week of which they work, subject to certain very limited exceptions. Again, please utilize the resource on the Department of Labor website, as this is one of the top questions that we've received as to how to compensate employees. So let's talk about discussions with employees. We know that as of right now, there are a lot of discussions and questions that everyone is having. What can the employer do from a standpoint of a best practice? What are they able to say? What are they not able to say? We'd like to provide you with some resources and best practices as to how to have some of these conversations. If you have an employee that is at work and showing signs of the virus, a common question is, are we as an employer able to send them home? Yes, you can send them home and request they speak with their doctor. Very simple conversation. Let them know that we care about their health and we want to be sure that they are taken care of. And also that will ensure we are protecting our existing workforce as well. Other discussions. Can employees be asked to notify their employer if they've come in contact with someone who has the COVID virus? Yes, please visit the CDC website for how to conduct and how to provide guidance on them for a risk assessment. Here's an example of sample language for employees who are ill, or if we have an employee that is here at work, what do we say to them? And again, that statement is very simple. We recommend you contact your doctor if you're experiencing symptoms such as fever, cough, or shortness of breath. A best practice is to avoid questions regarding potential disabilities or ADA. Again, having a discussion with an employee, we want to try to maintain confidentiality as much as possible. That is very key to be compliant with HIPAA regulations. So what does that mean for you as the employer? If you have an employee that is off on leave, or you have an employee that is being sent home ill, please do not share details as to employee names or which individuals are here and which individuals are off. Keep that information confidential, and that will help to ensure that you are doing as best you can to maintain that confidentiality, which is very important. Let's talk next about those employers that have started discussions, and some employers have already started to lay off workers or have discussions on reduced hours. These are always very tough conversations and never easy ones to conduct. The best practice that we have when we're talking with employees about layoffs and unemployment is keep the lines of communication open with these employees. Obviously, when an employee is off on unemployment, whenever the business picks back up and you want to try to rehire those individuals, it's easier to help to retain those if you've kept in contact with those employees over time. So, for example, if you're talking with an employee about needing to lay them off, tell them, please plan to check in with us periodically. We will keep you updated as to potential recall details as they are determined. And it is important to know, as an employer, if an employee is laid off because of the virus, employers can provide a notice that the individuals can be recalled in 45 days, which could be extended if the employee does not have to look for another job. So if an employee is saying, can I get unemployment and then wait until possibly you're ready to call me back? That's an option. But again, just keep lines of communication open. That will help you to try to bring those workers back and ensure that you have consistency in your workforce once things pick back up. As you know, the labor market is tight, but we also want to be sure that we're keeping in contact with those individuals. As we move forward and talk through resources, again, the slides contain a lot of information for each of you, and the handouts are very essential. There are continued updates hourly in reference to all the items that we've talked about today. I know there are a lot of questions, and I would like to extend our time and be able to answer those as best we can. I'm going to turn it over to Abby to talk through what some of those questions might be.
For unemployment, if someone is part-time and works 2 jobs and gets laid off of the one job, can they still get unemployment and keep working the second job?
That is a very good question. Definitely would refer that individual to, or the employer, to contact the unemployment site and talk through with them. They will look at what the employee's history has been from a work experience standpoint and how many employers they have worked for. So that's a pretty lengthy question, but they would be able to address and provide further guidance on that.
We are getting a lot of questions regarding the under 50 employee exemption clause. Could you kind of go over that, touch base again?
Abby, that question is for the new legislation, is that correct?
Right, that is correct.
So as the legislation currently stands with the new act, there is the opportunity for employers that have 50 or less employees to be able to say, we as an employer are not financially able to provide this paid leave, and there will be paperwork and different parts and steps that will be forthcoming as to directions for employers to follow. Again, this is a piece that hasn't been defined all the way through yet, but there are opportunities for employers to basically say that would create an undue hardship for us. So refer back to the governor's site in reference to that act. And we'll be sharing further details too as we move forward.
Are we able to request documentation for the paid leave request under FFCRA?
There will be paperwork that will be coming out in reference to steps that employers need to take. Again, that is part of the act that they will be further defining here as we move forward.
All right. Can we implement emergency furloughs versus terminating employees who then would lose health insurance? The Ohio Department of Job and Family Services information is contradictory to what DeWine is saying about who is eligible for unemployment benefits.
Yes, there is some conflicting information out there. And again, that is part of why we continue to reinforce the importance of looking at that unemployment site. There will be continued discussions. So there is the ability for companies to do emergency furloughs. How that affects benefits would vary based on the employer and the actual coverage. So again, that is something that will be further defined, and stay tuned for that.
And actually, I think for additional clarification, because I am getting a lot of questions on this, could we go ahead and go back in the presentation to the FFCRA page and just kind of review that whole process and what's going on with that?
So again, this is the legislation that just was passed last evening by the president. This is one that will be forthcoming with further guidelines for employers and employees. Basically, as the bill stands now, it provides paid leave for employees to be off of work due to the virus. The best practice that we have now is we just need to wait until the government has defined what exactly the steps are and what do we need to do moving forward. As it stands right now, this Family First Response Act covers free coronavirus testing. Again, it has the paid provision for emergency leave for 2 weeks. It enhances the unemployment insurance that we've talked about as well. So there's going to be continued updates to that, and providing additional funds for Medicaid. So this is an evolving situation, and this is something that as we move through the next couple of days to weeks will be further defined. The president, again, did sign it last night, but we do not know the actual effective date. We're just waiting to hear what that will be.
Okay. If we do send an employee home for showing signs of COVID-19, would they be covered under the act passed yesterday? Meaning we would give them that additional 2 weeks of sick time, which we could be reimbursed for?
Again, that's a great question. And anyone that is affected by the virus, either themselves or for a loved one, caring for a relative, or due to childcare because of the virus, will be eligible for the benefits. Again, it has to be defined by the government as to what that is. But as it stands right now, that's the qualifying event, is they have to be related to this virus. Something had to cause them to either be not working or be off work. So again, a lot of questions. I know it's at this point, it just has not been defined yet, but we expect hopefully they will do so in the next couple of days.
Could you explain a little bit deeply what shared work is and how it works again?
So shared work is an opportunity for employers to allow employees the opportunity to just do that, to share work. If you go to the website for unemployment office, it will also have a resource page for employers that talks about different types of programs that employers can put in place to help to continue production, but also be sure they're compliant with the regulations and under 10 people within a certain area. So some companies are implementing that shared work, and there's further details on the governor's page in reference to that as well.
Great. We have another question. Are employers required to ask for a physician slip, RTW slip, when absent due to COVID-19? And how does this play out with union contracts that do require physician slips for absences?
The quickest answer to that will be the reference to an employer requesting something from the doctor. Yes, there is, you do have that opportunity and that requirement to do that. That's part of what Family Medical Leave Act is currently states, that employees need to provide something from their doctor. The employer would need to talk specifically with their union reps in reference to how that would affect them.
Thank you. Governor DeWine is asking employers to check temperatures, and if not feasible, the governor is asking employers to require taking temperatures. What if an employee refuses?
That's a great question, and as I'm sure a lot of employers are thinking today, what are the requirements surrounding being able to take temperatures? For us, I would recommend that each employer look at it differently. It depends on if you have a nurse on site that can, do temperatures, please feel free and do so. The governor has made a recommendation, and all we can do is try to, apply to that, but make it based on your business as well. There really is no definition right now. If an employee refuses to have it done, there is no answer to that. I'm sorry at this point. I would think that there would be something that would be coming out to help us with that, but right now it's more so do the best we can.
Okay, federal government proposes reimbursing employers for compensation to employees for absences due to COVID-19. Does this apply to only private sector employers or also public sector employers?
At this point, that is still need to be defined as part of the act.
Regarding aid for financial hardships incurred in the COVID-19 outbreak, I'm hearing there may be a federal loan available that would convert to a refund after expenses are reviewed and approved by federal entities to compensate employees unable to work remotely and inevitably laid off because of stay-in-place/quarantine.
That's a very good.
Do you have any other insight?
And again, that's another piece of what they need to further define. There are discussions that, yes, the government's very focused on what can we do to help the employer too. So we don't have an answer to that. And that's just something that, again, we need to wait and see what the further guidance is.
Are there any concerns surrounding HIPAA or being considered a medical procedure in reference to taking employees' temperatures?
Yes, as we mentioned in an earlier slide, HIPAA is definitely something we need to be aware of, and without definition from the government as to how extensive we need to be with the temperatures, I mean, all we can do as an employer is keep information as confidential as possible. And, obviously we're not going to be, sharing names of employees. And again, that's a concern that's been voiced by a number of employers as to how do we comply with that.
Can an employee just quit and then expect to be paid once they apply for unemployment?
There are particular requirements per the unemployment guidelines that they would need to refer to. There are options. Traditionally, if an employee quits, they are not normally allowed or approved for unemployment. However, that could be part of the updates to the existing legislation. So at this point, we don't have an answer to that because that could change moving forward.
We have a lot of questions regarding the thermometers and taking temperatures for employees, Renee. There's some people who are saying that they can't find them anywhere. There's some asking, in terms of documentation, how many times someone should have their employees monitored, their temperatures monitored, and any documentation required. Is there any documentation required? Could you just, I know you don't know much on this because it's so new, but is there any insight you can provide?
I would say as a best practice, if you as the employer do the best you can. You know, documentation wise, again, there's HIPAA regulations, and, you know, for employers to be able to, I highly doubt that the government is going to come and say, please show me the register of all your employees' temperatures. I don't think that's feasible. So, you know, at this point, I would say if, you know, employers are able and can do that and can check it, that's fine. I would expect that we would hear something from the governor today, hopefully in reference to this during his press conference, as there are a lot of questions, as each of you have, as to what and how you administer and do that, especially given that there are no thermometers out there to buy. So
If an employer has yet to limit to 10 persons in a workplace with strong recommendation by Governor DeWine, will the company be liable if an employee were to contract the virus?
as these situations move forward, in your handout, there is also a website for the Bureau of Workers' Compensation. So it's important to visit that as well. There could be potential, you know, risk for employers if, again, it's an area that has not been further defined, but there is the opportunity for possible workers' comp. But again, it's going to vary by situation. I would highly doubt that, but please use that resource as an avenue for that question.
Okay, if an employee is older than 70 and requests a layoff due to being afraid of contracting the virus, which could be deadly for them, does the employer have to comply, and what happens if they don't?
That's a good question, and a reference for that would fall under a number of different legislation. Definitely the employer should look at the Americans with Disabilities Act and, you know, use that as a reference, because that individual that's over 70 is a protected class. So that is also a situation that would need further discussion, possibly with legal counsel on that.
If we have a PTO, if we have a PTO policy and not a leave policy specific to sick leave, do the employees have to use their PTO time first, or can they take advantage of the paid leave right away?
That is a good question. And the employers that have existing paid time off policies, it's at their discretion. There is no law that says that they need to require employees to take that paid time off. If they wish to, that's fine, but that is separate from this new act. So the new act will provide further definition as to how that would affect unemployment. You know, at this time, the best practice that we're recommending is employers, you know, if they have paid time off that employees want to take, please, they can do that. Also steer them towards that unemployment compensation piece as the best practice, because that would be the next step.
And just for additional clarification, is there no longer a 1 week wait period for unemployment?
That is correct. That 1 week waiting period has been updated. So there is no waiting period. And you can refer back to the unemployment site for that further information.
With a workforce of fewer than 50, if an employee were to test positive, what would the employer be required to do?
As far as under 50, again, whatever federal law is in place, that will be the presiding or the reference for employers to follow. There will be, again, forthcoming details in reference to that as to how that affects those employers that have 50 and below. That's part of the further definition of that act that they need to provide.
Mm-hmm. All right, what if, you know, in terms of the unemployment issues and everything, what if an employee only has 1 week of service with the particular employer?
Per the
as an example.
Guidelines, good question. If the employee would need to go to the employer web or to the unemployment website, There are eligibility requirements that they would need to look at, and there's about 5 or 6 different ones, specifically how long have they been at the employer, what is their previous employment. So there is a time frame that they need to have worked at your organization, so please refer back to that website for that information.
All right. Can an employee qualify for both unemployment and FMLA?
Family medical leave runs concurrent with any type of leave. So if, you know, and that is unpaid time. So if an employee is on unemployment, they are not an active employee. So there would not be that correlation. So FEMLA only applies to active employees. And it's, again, it's unpaid time.
Could you talk about childcare a little bit? We have an employee who is adopting and is restricted in who she can access for childcare. What are your thoughts on this situation?
I would refer back to the Family Medical Leave Act, as that has a provision in there for caring for, for children. This will also be part of the legislation that they're going to further define as to exactly childcare wise, how does that apply? Is there a time frame? Is there anything that's covered under family medical leave right now should mirror what is covered under the protected classes for the new act as well. They should go hand in hand.
Does temporary labor through a third party apply to the employee count of an organization? So like a temp agency?
No, the full-time equivalent would be active employees on the company's payroll only.
If we own 3 companies with less than 50 employees in each, do we have to combine them?
Is that question in reference to the family medical leave?
I believe it is.
And the 50, I would say that again, if you're looking at the family medical leave, it defines employers with 50 or more within a 75-mile radius. The 50 and under for the new act, that needs to be further defined as to if those entities would need to be counted as one or not. So that needs to be further defined.
Okay. We would also, we have people who would be interested to hear more about your recommendations for memos or addendums to the employee handbooks regarding the COVID-19.
That is a very good question and a very important part of as we move forward and look at being proactive as an employer. A recommendation, and part of what we will do as a continued update to our webinars as well, we'll be talking further about that, but looking at your handbook to ensure that you have family medical leave, that your leave of absences are covered. Also, the handbook should include Department of Labor information in reference to classification of employees. Are they hourly? Are they salary? This virus has also, required employers to look at temporary remote work policies and what options are for those in reference to a memo or a template format. If you go to the governor's site, there is also a resource page there for employers that talks about best practices in reference to those. Crisis communication plan and policies is another update that is something that employers are now looking at if they did not already have. Also, as we talked about before in the handbook, ensuring that you have a clause in there that if there were layoffs or furloughed workers, how that applies. So there are a number of policies that are best practices and should be continued to be updated, and some new policies that companies will want to look at as well.
So limiting, when they say limiting groups of 10 based on social distancing, does that include just the staff in the building, or does that include the staff and any clients who may be coming in?
That's a good question. My understanding is the social distancing is 10 people total. So I think, given whatever your workplace would be within 6 feet of each other and 10 and under would include anyone.
And what, just for additional clarification to point them out, what policies did you say are employers should employers be checking in their handbooks?
Sure. And this will also be contained in the slide deck. It's listed as to what our recommendations are, but those would include family medical leave, reference to the ADA, Americans with Disabilities Act, medical leaves of absence, also looking at your attendance policies, crisis communication plans and policies as well, looking at your Department of Labor and your compliance to those regulations in reference to defining what a work week is, classification of your employees, hourly and salary exempt, etc. Looking at, as we mentioned, some temporary remote work policies will be one that a lot of employers will be looking to include. And best practices in reference to if individuals were to be laid off. The employee handbook is crucial, especially in times like this, to be able to refer back to for consistency and compliance with regulations. So we see a lot of employers as we move forward will want to ensure that this is done and in place and updated. And there are resources for those as well.
All right, Renee, we do have a ton of other questions, and I definitely want to get to them all, but I do understand that it's just no way we can do that right now. I think this is probably a really great place for us to stop, just to be cognizant of everybody's time. Just as a reminder that we will be able to, we will take the time to answer all of these questions and send out the answers to make sure that we address everything that was addressed today and that was addressed in the questions. And Renee, before I read our conclusion, do you have anything else you want to give as parting words?
Yes, I would. And I know everyone, there are, as HR professionals, as owners of businesses, as, managers, supervisors, we all have so many questions. Please, the best resource that we can share with you are the resources and links that we provided in the materials today. The biggest piece is to keep in mind that there's so much uncertainty right now that the best that we can do is communicate consistently with your employees. Be there as a resource for them. Employees are looking to their employers to provide them with guidance. And although we might not have all the answers right now, it's okay to say that until we do have further definition. I appreciate everybody's flexibility in dealing with our technical issue here. However, the information is still attainable for you. Please utilize the resources that are out there. Please try to keep current. I know it's a lot of information, and we are here if you do have questions. So thank you very much.
All right, very good. And once again, thank you for joining us for today's webinar on what is life after coronavirus, understanding employer compliance and safety. We will, this is going to be part one of our series. We're going to have other webinars coming up related to not only updates for compliance and safety, but also to talk about things like cybersecurity and retirement planning. We all have questions related to that. But in the meantime, we really do hope that Renee was able to provide you with some valuable insight that will help you make sense of the current government recommendations stemming from COVID-19. If you sign off today and realize that you still have additional questions, you are absolutely always welcome to reach out to Renee directly. You can also contact any of our REA team members from the firm's website at www.reacpa, that's reacpa.com. And don't forget to watch your inbox for an evaluation survey, access to the recording of today's webinar, and more. Thank you again, and we really hope that you have a wonderful rest of your day.